episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Well, welcome everybody again to another episode of our show with another fascinating guest helping to create a better tomorrow for so many people. We have the honor today of being joined by Dr. Emanuele Capobianco, who is Director for Health and Care at the International Federation of Red Cross and Red Crescent Societies, IFRC, where he leads their global health and care team and provides strategic and operational support to 192 national Red Cross and Red Crescent societies around the world in the areas of community health, emergency health, and water and sanitation. He currently also leads IFRC's global response to both COVID-19 and their IFRC response to Ebola outbreaks. Before this role, Dr. Capobianco was the Deputy Executive, the Director of the Partnership for Maternal, Newborn, and Child Health, a multi-constituency partnership hosted by the World Health Organization and the world's largest alliance for women's, children's, and adolescents' health. And he joined there from the Global Fund to Fight AIDS, Tuberculosis, and Malaria, where he worked as a senior policy advisor in the Office of the Executive Director. Dr. Capobianco is a global public health expert. He has 20 years of experience in international institutions at country, regional, and headquarter level. He was the Chief of Health and Nutrition at UNICEF Mozambique, where he worked for several years to advance the health outcomes of Mozambican children and women. Previous to that, he was at the World Bank, a senior health specialist, maintaining a large portfolio of grants, particularly in Southeast Asia and East Africa. He worked in Somalia, supporting the expanded program in immunization and polio tuberculosis programs there, and at the World Health Organization Regional Office for the Eastern Mediterranean, promoting Stop TB partnership in the Middle East. Dr. Capobianco holds a medical degree from Pavia University, his master's in public health from Johns Hopkins Bloomberg School of Public Health, and a master's in humanitarian assistance from Rome University. Dr. Emanuele Capobianco, welcome to the show.
Thank you very much. Pleasure being with you.
It's great having you. I would love to start off, as we typically do, by giving you the floor for a few minutes, just to introduce a little bit more of yourself. If you could take us a little bit on your journey, everything from a little bit of where you grew up, how you developed your interest in medicine and public health, and a bit of your journey and how you got so interested in these major population health issues. I think that'd be a great way to start things off.
Well, thank you. I was born in a psychiatric hospital, and I lived the first years of my life in a psychiatric hospitals, and that's something quite funny. But I'm the son of a psychiatrist and a psychologist, and I come from a small village in the Alps, close to Switzerland, in the Italian Alps, close to Switzerland, where I grew up. A family that didn't have any connection with the international world, was very much Italian, and I grew up as an Italian. And I must say, my interest with the outside world started very early on with the little church in my little village. There was a missionary from Bangladesh who was working in Bangladesh and would come back every 6 months to a year, and he will just share his experiences. And that was the first time I kind of got an interest in the world outside my own area. And then I grew up in this little town in Italy with the desire to do medicine. That was my desire. I wanted to be a pediatric surgeon. Then I realized when I started medicine that my hands were not very good, and so better not to go into that field. And then I graduated in child neuropsychiatry. But during the years as a medical student in Pavia, I started using exchange programs for medical students, and I started traveling to abroad, first in Europe, in Germany, and in the UK. And then I wanted to go to Africa. So I had my first experience in '96, I think, was in Kenya, working in a small rural hospital a few kilometers away from Nairobi with a missionary hospital. And then before graduation, I had the privilege of winning the opportunity to go and work for a mother and child health clinic in Calcutta in India. That was again '98, before just a few. Probably a year later after Mother Teresa had died. So I also worked for some time in the house for dying people in Mother Teresa's house. And when I graduated a few months later, I had the choices to go and become a specialist in Italy or try this kind of unknown area, was the idea of working outside and in the humanitarian sector. And that's why I enter a master in humanitarian assistance. I told my doctor's parents I would not be a doctor, and that was quite something. And from there, I met at a conference a person who told me, who was from the Red Cross. He gave a presentation to a bunch of students from all over Europe. And I went to him and I said, I want to do what you are doing. What do I need to do? And he directed me to do a master in public health. And he told me, if you want to do a good master in public health, I would suggest you go either for Johns Hopkins or Harvard. At that time, we didn't have internet. I remember writing and asking the prospect to come to my place. I got it. I applied very late. And they called me. And then when I arrived at Hopkins in Baltimore, and I entered the School of Public Health, not knowing what public health was about, I found myself for the first time in my life in the place where I always wanted to be. And from that moment on was public health, global public health until today, and with no regrets at all, and a very enjoyable professional and personal experience.
Outstanding. You can't do much better than Johns Hopkins for as a place to end up. And Baltimore's a pretty nice city too. But I sit here a little north of Baltimore in the city of Philadelphia, here on the U.S. East Coast. About a mile north of here is the Philadelphia headquarters of the Red Cross. And typically here, when we think of the Red Cross, we obviously think blood. My children have volunteered over there for the blood drives, and we've given blood. Sometimes the plasmapheresis team will come to their school. But your purview in terms of the Red Cross and obviously the Red Crescent, which we hear a little less about here, is much broader. I mean, you're involved in everything from mine removal, clean water after disasters, issues of sexual violence, and so forth. Talk a little bit sort of about this broader role than we typically think of here in terms of sort of the blood drives and all, and specifically what falls under your purview as Director of Health and Care.
Yeah, the Federation of the Red Cross Red Crescent Societies, for which I work, is a federation of 192 national societies. They are Red Cross or Red Crescent. American Red Cross is one of those national societies, and then you have another 191 all over the world. It's a massive presence with approximately 14 million volunteers and 500,000 staff, that they reach hundreds of millions of people every year with a number of services. My area is what we call health and care, that encompasses all health activities, but also water and sanitation activities. And it's a massive area because Red Cross societies vary tremendously. In some places like Japan or Jordan, you have Red Cross's hospitals with Red Cross's doctors and nurses that run hospitals and deliver services like in a normal hospital. In many places, the Red Cross is involved with blood services, but in many other places, the Red Cross is involved with supporting psychosocial support programs for victims of war or torture, or psychosocial programs for vulnerable people. Right now under COVID, that has been an area in which we have really expanded very, very rapidly through hotlines that are being run by volunteers, or through programs that have our volunteers going into the houses of people who may be needing support, providing the psychosocial support that can come from just someone talking there, but also the physical support that comes from providing people with medicines, providing people with food or cash. The Red Cross is really where the most vulnerable are at all levels. So we are, of course, in the poorest countries. We are in the conflict areas, providing health and care support in Cox's Bazar in Bangladesh to the refugees there. We are in the Democratic Republic of Congo, fighting along with authorities and other partners Ebola. We are in countries that are more affluent, side by side with injecting drug users. with harm reduction programs. We are with the elderly, bringing forward programs against loneliness. We are with adolescents, trying to support them in that phase of their journey that is very risky through health promotion and disease prevention. And of course, we are in many places poor, supporting community health systems that can actually support poor people to be protected from diseases or to seek the medical support when is needed. So we are really broad, and our reach is huge. And of course, that is challenging in terms of from my side and my team sitting in Geneva, is really to connect with all the national societies that are across the world through our regional offices, through our country offices, and try to provide national societies with the up-to-date technical know-how on what is important for the work.
And as you were just mentioning, obviously, and we'll get into COVID and some of the other communicable diseases in a bit. But one of the things I just be very interested in starting out, obviously, you mentioned Ebola. You've been in the Democratic Republic of the Congo. I've seen actually you writing recently about the recent outbreak in Guinea. Can you talk for a few minutes about how your leadership and experience with dealing with Ebola, which obviously very different virus, might argue much more sort of short-term deadly, but obviously has the issues with spreading compared to what we're experiencing with the COVID. Talk a little bit about your learnings from these experiences with a disease like Ebola, and how that helped sort of you focus your current leadership and response to the COVID-19 responsibilities at IFRC.
Thank you for this question. Ebola, I worked for the past 3 years on primarily on the outbreaks in the Democratic Republic of Congo, and there were several outbreaks. They are now having the fourth one in just 3 years, and more recently, I've also been supporting the response to the Guinea outbreak that is unfolding right now. And if you ask me about the lessons, there are two words that come to mind. One is speed, the need to really intervene fast at the very beginning without fears in an environment that is usually with very scarce information, and in a way that may bring mistakes, but inaction is much worse than making mistakes. And so this speed, this moving rapidly with the right type of intervention is absolutely critical, and that's word number one. Word number two is trust, and if you want, you link it to fear. Communicable diseases are scary. COVID-19 is scary. Ebola is even scarier, and people can react irrationally in front of an unknown danger. And that fear is that anxiety is a normal, natural behavior that may translate as it did in DRC with people attacking health personnel and Red Cross volunteers who were helping people, killing doctors and nurses or burning health facilities. And it happened also with COVID-19. We have seen scenes similar in many other places, because human nature is the same in DRC as in Amsterdam. But managing that fear and building the trust in order to be able to support people in their response to a disease is a critical element of responding and managing outbreaks of communicable diseases. And for me, the biggest shift that I've seen over the years, at least for me, has been from biomedical intervention somehow directed from the very top, from the scientific gotcha down to the population in need, through a flipping of this paradigm with empowerment of communities, with the knowledge and tools that can help communities help themselves. And that is a shift that, for instance, in Ebola took some time to happen, because the biomedical line was clearly the one dominating. And if I look even at COVID right now, and you look at the vaccine hesitancy that is around with 30–40% in some countries of the population refusing to get vaccines, you realize that the issue of trust, fighting misinformation, and having credibility as an actor on the ground is of paramount importance to fight communicable diseases.
The IFRC president, Francesco Rocco, was just quoted in an article, actually, it came out a couple hours ago, where he's talking about, it's one thing to procure these vaccines, but now it's equally important that, in his quote, you have to, once they reach the tarmacs of the various airports they go to, they have to get off the tarmacs, and they have to be distributed equitably. And a major responsibility of yours is 500 million people, 100 countries. You are working with the COVID-19 Global Access, the COVAX group. Talk about, obviously your responsibilities here are huge because there's a population larger than the total population of the United States across multiple countries. But this theme of health equity is extremely important everywhere nowadays. You're not only dealing with it at one level, but obviously 100 different countries come into play. Talk about some of these issues that you're dealing with on this front.
I'm glad you mentioned our President Rocca, because he was the President Rocca who in June with the UN Secretary General Guterres launched really the call for what was a people's vaccine, was named a people's vaccine, to ensure that equity will be put front and central in the future of immunization against COVID-19. And the IFRC was very supportive of the establishment of COVAX, this international mechanism for equitable distribution of COVID-19 vaccines to countries that we know now, but when we were in May, June, that was not yet evident. Vaccine seems years away, but I think part of my job was to sensitize about my own leadership about the opportunities that would emerge around this for a better world, and making sure that we would be, as a Red Cross, Red Crescent membership, fully behind this initiative. And we have pushed for donors to join the COVAX, and we were very happy with the Biden administration to see that coming on board as well. And I think it is a moment of joy now to see that, in the last 2 weeks, more than 12 million doses have been brought to the capitals of 20 plus countries, very low-income countries. But, and this is what President Rocca said today, actually, with the press release, there is a deadly gap that is not being considered. The vaccines are being brought to the tarmac of the airports, but then there is a massive effort of logistics, of human resources, of social mobilization that needs to happen. And that is not being financed. This is where the Red Cross, Red Crescents are. That is where we work with governments, and we do have an auxiliary role to governments to support the distribution of vaccines. And we are already doing this. We have been doing this since January, when the first vaccines started circulating in countries in Brazil, in Bangladesh, in other places in Europe, where we are accompanying the distribution of vaccines. And I can say we have a target of 500 million vaccines supported by us. At the moment, they are early days. We have 7 million people that have been vaccinated thanks to the support of the Red Cross. And we have another 6 million that have been vaccinated for other non-communicable diseases like measles or polio. These are children that are being vaccinated, because one of our targets for our immunization plans is to focus on the COVID-19, but not to forget the other part. So our 500 million includes both, and we are already at 13 million as we speak. And not surprisingly, we have 100,000 thousand people from the Africa region that we have vaccinated on COVID-19, because there are no vaccines there, but we have the majority of vaccines that are distributed against non-COVID vaccine have been in Africa. And that that will change when the vaccines arrive. And we have good example from Morocco, for instance, where we have been able to support the vaccination for 2 million people. But that is happening, and we need to accompany national societies in their auxiliary role to governments to play an important part. And today we are also really putting the accent on the need of funding that part. The logistic, the distribution part, the operational costs that are otherwise not included in COVAX.
You, throughout your career, have been involved in many other what I'll call, let's say, plagues, both communicable. So, you've worked in tuberculosis and malaria, and we forget, but we've talked about this on the show, the millions that we lose every year to these other modern day plagues. And at the same time, there's also these what we'll call the hidden plagues, the non-communicable diseases that this COVID situation has highlighted. We take resources from here, we miss it, so it's over here. Obviously, I'm not asking you to solve some of these grand challenges by yourself, but could you take a few minutes just to talk a little bit about how someone in your position of responsibility that has experienced all of these different problems, how do you balance what's important to focus on next? Hopefully, COVID will disappear tomorrow, but you got a lot of other big stuff that is there that we can't forget about. So.
It is a challenge, and health is public health is so interesting and beautiful because it's so varied, and from a professional perspective, being at the global level, dealing with all these very different issues is extremely interesting. Now, the prioritization elements is a complex one. We went through, in our organization, we are a federation, so it's not me deciding, it's me facilitating the decision of the 192 national society of what should be prioritized. And we worked for 2 years to reach a consensus about what should be the priorities moving forward for the next 10 years. So we have a health and care framework 2030 that was just published in 4 languages recently, that try to zoom into the critical areas, recognizing the differences. Again, we are a global institution, so in the US, an American Red Cross would do something very different of what the American Red Cross in Sierra Leone will be doing. And as a federation, I need to be responsive to both institutions and then to collaborate and provide support to both institutions. So it's not easy. I can tell you, though, that we do have every 4 years an international conference that brings together all national societies and all member states to discuss critical priorities for health. And that defines some of the priorities. And the last one was in December 2019. And there were 2 resolutions that were adopted by member states and national societies. One was about epidemic pandemic preparedness and response. And it was called Time to Act, working against epidemic and pandemics together. And it was the 12th of December 2019 when this was approved. And COVID came up the following month. We were on that track because we had identified that this was an area where we had worked for many years with Zika, with Ebola, with polio, but where we wanted to have a stronger institutional positioning. And then COVID happened, and we were there, and we have been, supporting, reaching 260 million people through our services, providing 80 million people with cash transfer and food, helping 100 million people with water and sanitation. So we were there already, and that's an area that is going to be continuing as COVID evolves, and we will move into a global agenda for global health security or epidemic pandemic preparedness and response. That's going to be clearly an area. The other resolution that we passed, that the member states and the National Society passed in 2019, was a resolution about mental health and psychosocial support. And that was a movement resolution that brought together the Federation and the Committee of the Red Cross. Very important, because I think for the first time highlighted the critical importance of an area that has been neglected for a long time, particularly in humanitarian settings, but I would say globally. And again, the timeliness of this resolution, when that happened in 2019 December, when we see right now the impact of COVID-19 on the mental well-being of everyone around the world is incredible. And what I say is that the mental health impact of COVID-19 will outlast COVID-19 and are likely to influence generations in a way that we probably are unable to fully realize right now. Is a little bit, and probably you are a bit younger than me, but I grew up in the 80s and I was an adolescent in the 80s, and that's when HIV/AIDS exploded. And for us, trying to approach our own sexuality around that time with a lot of taboos around this disease, with a lot of fears, was extremely difficult. And I think a lot of our generation was very much affected by that. What we are seeing now in children and adolescents, in terms of the loneliness they have been experiencing being outside of school, the fears, the loss that many have experienced in their families, is going to really define a generation, and we need to be there now, and we need to be there as Red Cross, Red Crescent, after this COVID-19 is over, to bring back the idea of a better future in which hugging each other, in which having a physical contact is the norm and not a risky behavior.
Yeah, outstanding points. Yeah, we don't think about that that psychodynamic of everything that's happening to us, but I appreciate you bringing that up, because that's once again another sort of hidden component of this that we don't think that much about, but very important. Emanuele, you interestingly recently on your Twitter page, you highlighted a new job at the IFRC, the Director of Digital Transformation, where the organization is looking for a digital visionary with a passion for humanitarian work. Some of these topics in terms of digital health, artificial intelligence, and so forth are so hot in so many different corners nowadays, especially as it pertains to healthcare. Could you take a few minutes and just talk a little bit about sort of the digital vision at IFRC and sort of some of the interesting tools that you see or that you're interested in further helping with your mission?
Yeah, the digital health space is an amazing one that is moving at an incredible speed. And I had the fortune of being on the Lancet Financial Times Commission on Digital Health that will be publishing the report later this year. And we had a couple of years of very interesting discussions with the other commissioners around this area. And it's very interesting to see how split many are around the benefits and the risk of digital health. Mm-hmm. And the fight between a utopian vision in which digital health will solve all the problems that are not solved normally by the normal practice of medicine, and on the other side a dystopian view in which artificial intelligence will take over our own lives. And probably the reality is in between. And what I can see is that this field is moving very fast in a very unregulated space. And that brings opportunities, but also brings enormous risks. We saw during COVID-19 how telemedicine has become, in many areas, a reality proven to be better than the old-fashioned visit to the doctor and safer. And I was talking earlier about mental health issues. You can talk to your shrink from your couch without having to go and visit your office, that has advantages potentially, and that is something that, you know, it's really a fingertip away now, rather than having to travel and move around. And basically you have physicians from all over the world that can be your physician. The choice is extremely augmented, and that is these are just an example of opportunities that are emerging. But we do have also risks, and I think, again, if I think about COVID and the tracking, contact tracing application, the tracking apps that have been developed, they were very fashionable in some countries. In other countries, they didn't take off, and they didn't necessarily take off because there were issues around data and use of data that were not clarified. And the data protection, I think, is one of the most critical issues that comes when we talk about digital health. And for me, for us at the Red Cross that work in humanitarian settings, that is a specifically important issue, because people who may need to download an app that may provide them with vouchers to go to the doctor, or vouchers to buy food, or else may have no choice, would go for it right away. But if that person is a refugee that is fleeing, and those data are stored in an unsecure place, that refugee may be tracked down, and there may be consequences for him or his family back in the country of origin. So just to say, the data protection issues is central to that. That said, in the governance at the national level, at the global level, is something that will need to be developed in the years to come, and it's not going to be an easy process, also because technology moves faster than anything else, and we have a lot of apps that are out there performing duties that normally a doctor would perform, and we have no evidence necessarily behind it, and people are downloading them, and that is something that we are facing without having a response. But this can be risky, and trying to regulate a market that is so free is not going to be easy. It's probably going to be impossible. But having some filters mechanism that can, for instance, allow certain apps to be screened and vetted by regulatory authorities, that then will allow them in the markets, and they will allow them, for instance, for insurance purposes, that would be something that could facilitate the best of the tools to be made available for large populations.
Emanuele, we started off our discussion at the beginning of your career, actually the beginning of your life. You talked about your parents and the importance in their guiding you. You obviously met a wide range of fascinating people throughout your career in government, in non-governmental organizations, industry, and so forth. Take a little time, if you would, to highlight anybody else in terms of mentors, influencers that have been really influential in guiding Dr. Emanuele Capobianco's career, and then, types of people, and if it wasn't for them, you'd be maybe practicing family medicine or doing something totally different than what you're doing now. And take your time with that one.
Yeah, I have two people that comes to mind immediately. One is very personal, but is my grandmother, who was a widow who had a curiosity for the world. And as I said, my parents were very conservative, would not travel anywhere, but she would go with her friends for a trip, one, maximum 2 trips per year. And that was her luxury around the world when I was a kid. And when she would come back, she would bring staff from all over the world. She was in China when China just opened to tourists in the 80s. She was in Argentina. She went into to Africa, and she was an explorer. And she put the seed of a traveler in me through her little gift, and they were very simple. They were stamps from different places. They were just toys, but that opened to me the world, and I think that was really an inspirational figure in my life. And if I can just say, that is what then made me once cut, when I was a medical student, cut an ad that talked about a junior program officers program of the United Nations that would bring junior professionals into the UN. And I didn't know anybody in the UN. I didn't even know what the UN were back then. Again, coming from the Alps, and I cut it and I kept it in my drawers. And then I applied once, applied twice, applied 3 times, and finally got in. And that was because I had this dream of being at the UN and having all the flags around me and being part of that. And I must say, I still have emotion when I go back and I enter the World Health Organization, for instance, on that, or being with the Red Cross for me is being part of this global world has been truly amazing for me. Again, coming from where I come from. The other person I wanted to mention is Annalena Tonelli. Annalena Tonelli was an incredible woman who for 30 years, she was a lawyer, for 30 years operated in Somalia for tuberculosis patients, with building hospitals and treating with an extreme level of care patients with tuberculosis. And I worked with her for a few years when I was at the very beginning of my career. She was an advisor at that time for the World Health Organization, but she was a woman who she had 2 clothes, and she would leave complete poverty and full dedication for this for her patients. We worked together in South Sudan. We were a team of 2 that went into South Sudan for several weeks. Actually, on September 11, 2001, we were in Nairobi with the towers crumbling, and the decision to say, do we go into the South Sudan Christian that is being bombed there tomorrow or not? And she told me, Emanuele, we go. We don't discuss it. We went there. We went into South Sudan for a month, traveling on terrible roads to visit all health facilities that were there to develop the first guidelines on tuberculosis control in South Sudan. And we had enormous adventures. I took a picture of a truck which was covered with hundreds of people that were on top of this truck, and then I was almost put in jail because of the picture, and I almost risked to be killed because of that. We had these fantastic adventures. Then I became the WHO officer for tuberculosis control in Somalia, and she was working in Somalia, in Borama, in Somaliland, and so we collaborated very, very closely on her work. She was an incredible woman, the most intelligent woman I've ever met, with a level of commitment and care, and an example of altruism, generosity. She was killed on the 5th of October 2003, and that sacrifice was fully in line with her life, something that she expected, something that kind of welcomed, but her voice, really pure, of total altruism without any desire of fame or any desire of recognition, for me has been a voice that has been in me since then, and to which to confront with all my limits, which are many, but a person who has really kept me true to the mission of helping others, that's for sure, and trying to do in a way that is caring. That's care was a word that she used a lot, and I'm very happy that my title is Director of Health and Care. I didn't decide it; I found it, but I thought it was serendipitous. And to me, that element was very important. So those two people have been the ones who certainly have influenced me the most, and there are others, but those two for sure.
Wonderful, wonderful story, and a very inspiring message, and I really appreciate you sharing that. It's been a fascinating time listening to your journey, amazing set of journeys that you've been on, and really wishing you the best with all of this and all the responsibilities that you have moving forward for so many people. For everybody that's going to be listening to this particular episode of the show on the podcast or watching on the YouTube channel, you've been spending time with Dr. Emanuele Capobianco, Director for Health and Care at the International Federation of Red Cross and Red Crescent Societies. Emanuele, I want to take time. Thank you again for coming on the show and spending time with us. Thank you for everything that you are doing for the world. And as we say on the show, thank you for helping to create a better tomorrow for so many people that are out there that need a better tomorrow. It's been very inspirational listening to you.
Thank you very much. If I can just say one last thing,
please.
There is one element that I strongly believe in, and is change, and not being afraid of change. One of the things that I learned from Annalena Tonelli was having courage to change and jump beyond the fence, following what your dreams are, what your deepest desires are. No, if a dream doesn't scare you, it's not big enough. And I think that is very true. And to change, one needs to dream, and in order to realize your dreams personally, professionally, one really needs to have the courage and take the jump. And so that's one last message, because I think it has been very important in my life, my personal life, my professional life, and it's something I wanted to share with whoever will be listening to this. And thank you again for having me on the show.
It's a beautiful message, and I appreciate you taking the time to give that. I think we need more. We definitely need more change, more acceptance of the whole process, and I really appreciate you mentioning that as well. So thank you once again for coming on the show.